The Davis County Health Department is looking to increase its staff to help combat the growing numbers of COVID-19 cases. They're looking to fill dozens of new positions. Northern Utah specialist Mike Anderson explains where those new hires are going to help. Mike?
Yeah, Denny, a big part of the focus will be on contact tracing to try and reduce the spread. But, ultimately, this is a statewide effort. Davis County just wanted to get an early start on preparing for the months ahead.
It may seem alarming to some, but the recent spike in COVID-19 cases around the state are to be expected.
And we bent the curve and we lowered it, but now as we start opening up the economy, we fully expect cases to rise here in Davis County.
Director at the Davis County Health Department, Brian Hatch, says it's part of the challenge in trying to balance reopening the economy with public safety. It means they'll need additional help in keeping the number of new cases as low as possible.
Contact tracing investigation is one of the critical components to managing an outbreak.
And that's where the bulk of the new hires will be focused. Davis County Health is looking at up to around 40 new positions, all depending on how much funding they can round up between state, local, and federal funds from the CARES Act.
Every case that comes in, we call that individual and we interview them, and we go through an extensive history of when did they get sick, go back a few days, up to 7 days before.
While tools like the Healthy Together app can help, it's ultimately up to investigators who will need to track down the people who were potentially exposed to the virus. Hatch says the new hires will realistically be needed into the next year, but on top of that, he says all of us will need to take precautions ourselves to slow the spread, maintain social distancing, and use masks.
We're doing well as a state, the hospital, but it is a concern. We're cautious.
And another big reason for the increase in staff here is so that the regular staff can get back to what they usually do, offering the many other health services that are needed in the community. Many of them have been working overtime to keep up. Back to you.
I bet they have been. Mike, thank you.